5 ways to tell your business needs HIPAA compliance consulting as soon as possible. Staying HIPAA compliant as a healthcare facility is a difficult task, not only because the Health Insurance Portability and Accountability Act was enacted first in 1996, but also because many of its rules that were gradually added are confusing and requirements vague. You can start by watching 5 signs that will help you evaluate if your healthcare business needs a HIPAA compliance consultant immediately. 5 ways human error requires HIPAA compliance consulting. Human error is the primary cause of HIPAA policy violations and data breaches. No owner and manager deliberately risk their business by violating HIPAA regulations, but here are 5 ways human error can make its way through. Your training program lacks HIPAA risk assessments. You can't expect your employees to comply with rules they don't know about, especially for regulations that are always changing, like HIPAA's. Effective compliance training is the first step towards an excellent compliance program. Your training program should be based on any risk assessments associated with HIPAA security, privacy, and breach notification rules, at the very least. So, taking HIPAA's own training course is an excellent way to make sure you and your staff won't be missing anything important. In addition, not all of the Annual Officer of Civil Rights, OCR, audits and assessments are required of your business, so focus your attention on those that apply. Your facility lacks a HIPAA compliance officer. Having a quality HIPAA compliance training program won't keep your business safe if there isn't someone whose primary role is to ensure the HIPAA privacy and security rules are being met and enforced. If you didn't know, HIPAA requires having a compliance officer if you are a covered entity, that is, a healthcare provider, health plan provider, or healthcare clearinghouse. In addition to making sure everyone in your business and your business associates are compliant with HIPAA, a compliance officer will conduct annual HIPAA training with the rest of the staff with the annual HIPAA checklist, run IT backgrounds, audit systems. Your security measures don't meet current standards. Successful security risk assessment models will accomplish 4 things. 1. Identify all of the most crucial technology assets and create a risk profile that makes it clear which systems and tech equipment are at the greatest risk of a security breach. 2. Assess the security risks and construct an efficient and effective way of containing and minimizing those risks. 3. Put the mitigation plan into action with enforced security measures for each asset risk. 4. Have preventative measures in place, such as system tools and processes, that will minimize any weaknesses in your assets in the future. Being caught without the ideal protective levels and risk prevention would result in a crushing fine for you. Third parties you hire do not have BAA contracts. Anyone who handles your patient's personal health information, whether they are part of the healthcare industry or not, must comply with you on the use and accessibility of PHIs according to the dictation of HIPAA standards. If third parties don't have the BAA contracts, you are the one who takes all the blame. Third parties that should have a BAA include company lawyers, company accountants and billing companies, email encryption service companies, data storage/medical record companies, IT contractors, etc. Your online PHI data storage has minimal security. IT systems have been the biggest source of confusion in compliance to HIPAA. Back in 1996, IT systems weren't the security concern they are today with PHIs. Now, HIPAA has numerous recommendations for the protection of electronic PHIs, ePHI, that every member of your staff can do, such as logging off of their workstations when leaving. Never leaving PHIs unattended. However, when it comes to making your IT systems and online business compliant with HIPAA, the online data must be protected through the following options: hierarchy of authorized personnel, backed up data, encryption during transport, encryption during storage, permanent deletion when no longer required. Make sure the documents cannot be modified. Conclusion: if any of the above problems are what your business is experiencing, you need to set up an appointment with a HIPAA compliance consultant as soon as you can. If any security and compliance gaps are found in your training program, it would be a good idea to let the consultant evaluate other areas of your facility, like your data security or the quality of the work of your current compliance officer.